Hello there, Dr. Zakir Hussain with you, and the topic is obstructive sleep apnea in children. This topic I have taken 5 parts, and this is a fifth and the final part where I am going to discuss or I am going to tell you about the management of sleep apnea. The commonest cause of sleep apnea is adenotonsillar hypertrophy, adenoid hypertrophy and tonsillar hypertrophy together. And if adenoid and tonsillar hypertrophy is there and the child has got sleep apnea which is moderate to severe, it can be easily treated with a surgery which is adenotonsillectomy. So here I am going to tell you about the general management of sleep apnea, not only one particular cause. To start with, if the child is obese, which is one of the most important causes for sleep apnea, the first point is going to be, the first treatment part is going to be, we will refer you to a dietitian and they will note down and they will tell you the diet control, the diet modification, so that the child loses the weight gradually and he comes, so that he improves in his sleep pattern. And it's always better you avoid junk foods and avoid oily and fat foods and avoid Pepsi, Cola and all the cold drinks, so that you can reduce your weight. And along with that, you need to do regular exercises, walking exercises, in such a way in the exercise so that you sweat a lot. So start sweating when you walk, and minimum of 20 to 30 minutes, minimum, that's what I'm saying, is minimum. And you can do yoga exercises and breathing exercises also along with a normal exercise. Now, non-surgical management, if suppose the child does not have adenoid hypertrophy or tonsillar hypertrophy and he has got a significant sleep apnea and the child is also obese, the best way, in the shortest way to treat the case is by giving him a PAP machine, positive airway PAP machine. And what the machine does, it blows in air at a particular pressure and it dilates the airway of the child so that he can breathe in normally. And first 2 days the compliance is going to be very bad. They don't want to see, like what you see in the picture, the mask is huge, it covers, it has to be like that, otherwise it doesn't work. So they don't accept it very fast. As and when they start accepting, and within 2-3 days you will start seeing the changes in them. So all the night and day changes which I have mentioned in the previous parts, all that is going to revert back to normal. So this is one of the non-surgical management. The commonest cause being adenotonsillar hypertrophy, the surgery is going to be adenotonsillectomy. Maybe along with this, the child has got other problems like deviated nasal septum. Maybe he doesn't have adenotonsillar hypertrophy, he has got some changes in the voice box just above that, or his tongue is huge, macroglossia, which is obstructing when he sleeps. And we feel that just not PAP machine, we will be able to do some tongue surgery also. In that case, with a coblate or radio frequency, we will reduce the size of the tongue. But one point I would like to tell you, the septoplasty, usually we don't do below the age of 18. If at all it is done, that is not the only surgery being done. We will do combine with other surgeries and we are going to do only limited septoplasty. The complete septoplasty will be done only after the age of 18. And sometimes what happens is, the part behind the tongue, which is called the lingual tonsil, that will be enlarged. We can reduce it by surgery. And orthodontic surgeons, they can do maxillary and mandibular surgeries. They can do advancement, mandibular maxillary advancement, so that the airway behind that particular part is widened up and the airway becomes patent. They will be able to breathe normally. When they breathe normally, they get a good oxygen supply, which resolves all the problem. So this is how we manage sleep apnea. I have told you non-surgical management and the surgical management. As far as the ENT is concerned, the commonest cause being adenotonsillar hypertrophy, which can be easily treated. If suppose the child has got sleep apnea also, it can be easily treated by undergoing adenotonsillectomy. So that is how we manage such cases. Thank you so much.